So today we're going to talk about two elements that have to do with student assessment. Element 9.5 speaks specifically to students getting feedback when they are in courses and in clerkships. And element 9.8 speaks to end of course or summative assessment and the timeliness in which we provide that in. Regarding element 9.5, providing students with written narrative is crucially important to their development. Without them having those specific comments, it's hard for them to know what to actually do better the next time through or as they're growing and developing in their experiences. Element 9.8, the element around timeliness, states that we have to get students' grades back to them within a 6-week window. The reason this is so important is that if students don't get these grades back within a reasonable time frame, it makes it difficult for them to apply what they learn from this assessment to their next rotations. Around both of these elements, we've had ongoing quality improvement processes that we have put into place. For element 9.8, the timeliness of grades coming in, starting in 2015, we sent out regular reports to clerkships as well as clerkship administrators and faculty directors in letting them know the time in which they were able to get grades in. Based on this quality improvement process, we have now achieved our goal that all of our required clerkships are getting grades in within 6 weeks. In addition to this, for our first 2-year courses, our grades have come in within 4 weeks, and most of the time actually meeting a 2-week window. Regarding narrative assessment, the Medical Education Office has worked with our first 2-year patient, doctor, and society instructors in our legacy curriculum to make sure that they're providing narrative feedback to our students. In addition, we've worked with faculty involved in the integrated neurosciences experience to make sure that they've been able to provide narrative feedback to our students. In our new forward curriculum, we have a set of longitudinal teacher coaches that will work with our students across all 4 years very intensely in our first phase of our curriculum. We have had the opportunity to provide this fixed group of faculty with robust faculty development so that they are able to not only provide narrative feedback to our students, but to ensure that that is of high quality. In addition, we make sure that all of our clerkships are providing narrative feedback to our students within the context of their final evaluations. So to summarize, element 9.5 speaks to students receiving narrative assessment in our clerkships as well as in any other courses that allow for it. Element 9.8 speaks to our students receiving timely assessment, and this means getting grades back or assessments back within 6 weeks of the end of a course or clerkship. To summarize our quality improvement process, the Medical Education Office has made expectations for returning grades clear. And in our ongoing feedback to clerkships, we have been able to achieve our goal of receiving grades within a 6-week window and often down within a 4-week window. Regarding narrative assessment, we have developed a process by which all courses and clerkships are able to provide narrative assessment to our students. And also we've developed a robust faculty development process within our forward curriculum for our longitudinal teacher coaches.